Good morning and good afternoon, everyone. Happy Thursday, and welcome to the latest Practice Perfect webinar. My name is David McCarthy. I'm a marketing manager here at RevenueWell, and I'm going to be your moderator today. Today, our webinar is on how to run an attractive practice, and we're so excited about our guest. It's Rex Plamann, the president of ddsmatch Chicago. Rex is a dental industry veteran with more than 25 years of experience. He has studied the operations of thousands of practices, building an immense expertise in and passion for practice operations. One quick note about today's agenda. In a minute, I'll hand over the microphone to Rex. Once he finishes up, we'll have a quick Q&A, provided we have enough time, so feel free to submit any questions that you have using the webinar's control panel. We'll do our best to get to as many questions as possible. So without further ado, Rex, the floor is yours.
David, thank you so much, and thank you to everybody for tuning in today. Before I get going, I just want to thank my friends at RevenueWell, the great partners they've been for me for so long, ever since they really jumped into dentistry. Grateful for this opportunity to present today. We're talking about running an attractive practice, so if you thought you were signing on to run an attractive hair salon or a basketball practice, you're on the wrong channel. But we are talking about dental practice and the appearance of the practice, the perception of the practice. We'll get into some key metrics and whatnot. I'm coming to you live from Elmhurst, Illinois, outside of Chicago, just south of O'Hare, if you've been to the city. I had to put a little blurb in there about the weather. I think we've all succumbed to a pretty tough winter this year. No different here in Chicago. No snow cover on the ground right now. Plenty of ice and plenty of frigid temperatures, as you can see. Does that say 7 for Saturday? A low of 7 for Saturday. We've had enough. Thankfully, the days are getting longer, and this weather shall break up shortly and bring on better warmth for us all. I've been in the industry over 25 years, mainly in the Midwest. I spent a lot of time at a leading distributor in leadership positions for about 18 years. Last 12 years there, leading the branch in Chicago, overlooking the sales, the service, and the support team, and obviously working hand in hand with a lot of dental practices. I then turned my time in my career path towards ddsmatch, signed on with them just over a year and a half ago. Excited to be there, working on some great opportunities with clients to make sure major transitions in the practice go as best as possible. Let's get to the meat of the program. Running an attractive practice. I'm not really talking as much about appearance as we are about how the practice is run. So how that engine is firing and where the value resides in the practice based upon our performance day in, day out, keeping our eye on daily goals and long-term goals as we work through attracting people, mainly patients, staff, and maybe future providers to the practice. So we'll talk about whose perspective matters the most. We'll talk about key metrics to keep an eye on to make sure the perspective and the look of the practice is at the highest possible levels. Later on, we'll talk about a little bit of practice transitions and what is the true definition of practice transitions. And then we'll talk about the transitions we've experienced and some of the pitfalls we've seen that really have a correlation to how the practice is being run, how attractive that practice truly is to patients and staff and future providers. And then, as David said, we'll leave time for questions. So what is perspective and people's perception? What does that have to do with the dental practice? It's like any other business or service or entity. It's the way people look at an item from a certain distance or from a certain elevation or from a certain angle, and it brings value. It's their appreciation of the value of what they're looking at, basically. And obviously, when we're thinking of a dental practice, people are always looking at a dental practice. They can either see it as they drive down the road, they can hear about it from their friends and neighbors that have experiences in the practice. Someone's always looking, basically. And so what this is all about is, are we an attractive looking dental practice? If we are, certain metrics that we'll discuss here in a minute are flowing well. And if we're not, maybe people are going to be turning away or keeping away, and we never knew about them. So we got to keep perspective in mind because it really drives value. It drives the value of the dental practice. So whose perspectives matter the most? I would first obviously start off with the client, and in this case, the patient. They drive most of the value of the business at the end of the day by choosing to walk through those doors and have their dental care provided by you. And it's not just the current patient base. It's not our regulars and those loyal patients that we're always worried about and what their perspective is like of us, but it's the future patient as well that matters just as much. And we'll get into some of the reasons why in a little while. And staff, their perspective matters big time. Everybody's very keenly aware of what's going on in the community today, in businesses, in our schools, in all the different places that we can spend our money. And it's no different when it comes to the dental team and how they look at the business they're working for. And is that a great facility? Is that a great business to be a part of? Do they take care of me? Their perspective matters big time in how they value working at your practice, because they formulate a lot of stability with the patient base, a lot of relations with the patient base, and the future patient base that'll be walking through the door. And then you've got folks that might be looking for another opportunity down the road, and they could be the future staff member of your practice. But do they already have a good value of your business, a positive perspective on your business, or is it a negative one and therefore not a place they would ever consider working at? Because there will always be some staff turnover that we can't prevent, right? There will be folks that are relocating because a spouse got a better job in a different state, and someone might retire from the team. And so we got to be ready to attract in a new staff member at any point in time. And then what really also matters is how the dentist, the owner, feels coming to the business every day. And how do they suit up to get ready for their day and to provide the care their patients need and work with the team? Do they feel good about walking in the door and getting through the day? Because at the end of the day, they also spend their most waking moments in their lifetime really in the practice. So they need to feel good. If they don't feel good and have a valuable perspective on the business and how things are being run at the practice, their morale will fall, and so will the morale and the enthusiasm around them with patients and with staff. And you never know when another dentist is going to be needed. So we need to keep perspective on our value in the community and how we look to other people for someday we might need to attract an associate dentist into the practice, a future partner into the practice, or a future owner into the business. So perspectives really matter, and people are always looking around and they're trying to figure out where the best place to spend their money is. And it's already an uphill battle for dentists and dental practices to attract more patients into the practice. You can see on this graph here, this graph was provided as a part of a study done for the ADA by the Health Policy Institute in 2017. And these figures are from 2016. And what it shows is it's mighty difficult to attract new patients into a dental practice. Just over 50% of Americans go to the dental practice on a regular basis or annual basis. And here's what the folks that aren't are saying. The cost every day is just too much to swallow to go to the dental practice. And we need to really look from their perspective on the dental practice. Where do the dollars lie? Those discretionary dollars that they could spend with your practice is directly correlated to dollars they could spend at a local restaurant or at the Apple store or the nail salon. And so for what they believe your practice to be today, cost is too much of a factor to jump in. That's what these folks are saying. And then others have had a bad experience in the past, some way, somehow, and they're saying, you know what, I'm just afraid, I'm not going. And so what this graph really shows us is we need to take care of the business as it is today and realize we never know when people are going to be looking to jump into that practice in the form of a patient, in the form of a staff member, etc. Because rookies aren't humans anymore. I should have put a strike through over that little rookie human sign there. It's too easy for us to be educated upon what's going on with any business today because of Google or because we can just dial up Siri and figure out who's got the best reviews in the community for dental practices. So knowledge is right there at the fingertips for everyone. It's not just what they can see from driving down the road and looking at your parking lot and hopefully not seeing any siding coming off the side of the building there. But obviously people are more educated and in tune with what is going on with practices in any business, frankly. So what are the key metrics that I've mentioned here? Key metrics to make sure we're running an attractive practice. The ones that I feel are important start with new patient flow. We can't ignore technology. It used to be a really bad word, but I think it's what is needed today to be efficient, to be competitive, to be productive and profitable. And then communication. Communication is always huge in any business. So we'll talk a little bit about communication. That leads into having a strong staff. And then, yes, a little bit about appearance. And we're not going to talk about becoming Pottery Barn, but we got to look sharp. We got to look good and clean. And then profits are big. Profits are big for any business, and profits really allow for great opportunities to present ourselves to more patients, to bring on more team members, to broadcast better through the community that we serve. So what does new patient flow look like? New patient flow is critical not only to the dental practice, but just any business. Most businesses out there, the best run businesses, will have a 10% annual attrition. And that means a loss of regular customers. And that 10% you can't really prevent. Unfortunately, some of the patients you serve and people's clients, they're dying, right? They got to die someday. And others are relocating. You just can't control that. Jobs change and whatnot, and people have to move on. So even if we're running the best dental practice, which can be compared to businesses like Apple or Lexus that have some of the highest customer satisfaction rates on the planet, well-run dental practices are right there with their ratings as well. You always need to keep an eye out for new patient flow because we'll always be trying to make up at least that 10% gap. And regular patients, we're seeing more on this. There's a lot more studies out there that are showing regular patients just don't need as much care. They're diligent about coming in for their hygiene appointments, and that's terrific. And we know them and all their pets and whatnot. But frankly, they kind of stabilize and they don't need as much care as they go on in the practice until much later years. And so what we have with new patients is generally more opportunities to prosper with production and to bring about a little more care for the practice to be provided. And that in tune really kind of excites people. New patients need more work, and new patients also boost morale. New patients will kind of put a little more pep into our step, so to speak, and bring a little more enthusiasm, because I think we all work a little bit harder when we see a new customer, and we want them to feel comfortable with our business. We want to share more with them, educate them, etc. So it definitely boosts morale. There's definitely an increase in profits and value of a business from new patient flow, and that's a no-doubter. And then later on down the road, when you're thinking about a new hygienist, when you're thinking about bringing on an associate, the best way to really be able to not only entertain and attract them to the business, but to make it a successful venture together is you need good new patient flow. And we'll find that too with the valuation of businesses down the road when it's time to think about an exit strategy. So no doubt new patient flow is a huge factor in keeping an attractive practice. Utilizing technology, that bad word that I mentioned, it used to be a bad word. It's not anymore. I think we all realize that today's tools that we used to call technology are essential instruments for boosting really the trust from patients, production, morale of our team. And I sort of think of technology in this way. If you've got yourself and 9 other practices around you, so a total of 10 practices in your neighborhood, so to speak, how deep has this technology you're thinking of penetrated into those 10 practices? Are we still on the leading edge where only 2 to 3 practices have this technology? Are we already at, 8 out of 10 have this technology and you don't have it in place yet? Then I think we're falling a little bit behind what might be seen as standard of care. And I'd want to be on board with whatever technology that would be before we get to 8 out of 10 in the neighborhood. So I'd want to be the guy that's looking at technology when it's not on the leading edge where I'm like a guinea pig, I'm like the beta tester, so to speak, but where it's stabilized, it's proven itself, and it's going to be a great productive tool for the practice. One of the bigger success stories in dentistry with great technologies in the last 25 years has been really, I think, digital intraoral x-rays. They've got to be into 90% of all practices today. And it was certainly good to be involved early on with that technology, but maybe not the first to jump in, where images just weren't worthy enough at the point in time to be in that technology. But today, they're incredible tools and almost everybody has them. So technology is a big part of a good appearing practice. And people who expect to see this when they're looking to invest in your business, staff members will be looking for these tools. New staff members coming in will be looking for those tools, especially if they had them somewhere else and now they're thinking, well, maybe I want to work at this other practice over here. And what does that look like on the inside? Do they have some of those tools? And if they don't see them there, they might go looking somewhere else to work. Communication's key to any business, as we know. I love what's happening with phone systems. I know RevenueWell just introduced a great new phone system. That phone system will definitely increase efficiency, convenience, and tie to the patient. That's what we're looking to do. And communication doesn't stop there. It's with the staff as well. I just was in a practice the other week. Large private practice, had 9-10 operatories, 18 staff members, and they had some slick tools. They had the headsets with the battery packs, and they had this special little area in the basement where they're all charging and they're all lined up and they're all numbered. Each person's got a number they're assigned to, and I just love seeing that. And it just made me think, this is a really, really well-run place. They really care about efficiency and taking care of patients and keeping appointments on time. I bet you they had other great communication tools you could, assume from there. And then communication, kind of changing it up here for a second. Communication is all about really keeping people's privacy too. So when we're sharing thoughts and ideas with patients, are we in a safe harbor, so to speak, when we're doing so in our practice, and can patients realize that? So we have to have safe places to have privacy, etc. And a lot of the tools in place today keep people's information private, which is great, and follow all the HIPAA rules, but we got to be aware of people's privacy. And that will be, something that people will notice too as they're interviewing your practice to potentially work there and spend maybe their career there. Staff. Staff is critical. Sorry about the dog barking in the background. I knew that would happen. Strong staff is critical to running the dental practice. You got to make sure we have the right members on the bus, and this can be a sensitive subject. But really, you need a strong team, and a strong team will attract other strong team members to join your team. And obviously, everybody wants the stability. They want the stability with the people that they're interacting with at the dental practice, from their hygienist to the person that answers the phone to make their appointments. They generally want to see the same provider as well. They want to see the same dentist that's taking care of them when they're in a time of need. And when we have a strong team in place, other people will notice. Other people will definitely notice, especially when we're interviewing a new hygienist or front desk member, potentially an associate to come into the practice. Oftentimes, they're very quickly interviewing with or interacting with the staff around you, and they will immediately be able to draw conclusions as to, what are these people like in this practice? How do they work together? They'll get that vibe. They'll just know. So that's another reason for having a strong team around you. It will help raise people's perceptions of your business. They'll bring it more value ultimately, and they'll feel better about coming to work there. So it definitely attracts talent. Yes, of course, I had to have an ugly looking operatory in here. Certainly nobody's working in these conditions, today, but it wasn't too long ago you saw a lot of taped up chairs and whatnot, and it's just not okay today. And it doesn't matter who we're serving. It doesn't matter the patient that we're treating. And it's more than just the patients as well. It's our staff too. And it might be okay for the doctor. It's very easy for the practice owners to rationalize that, what, it's good enough for me. It's good enough for me. But, in a most sensitive manner and delicate manner, I'm saying, what, but it's not about you. It's about the patients, and it's about your valuable staff and how they feel about going to work there. Do they feel safe? Do they feel like it's a good clinical environment? It doesn't have to be picture perfect, and we're not worried about, making sure that we got all the right color tones on the wall that make people feel calm. It's just about having a bright, clean, clutter-free environment that has a little modern vibe to it. And there's certainly OSHA standards. And, sometimes this is why staff is leaving, and they don't necessarily want to tell you. People want to avoid conflict, but sometimes when patients and staff members are walking out, it might be because of the way things look in the practice, and that the way that makes people feel. So be aware of your appearance. Kind of walk into the practice next time as yourself as thinking of a staff member would, or walk in the shoes of a patient. Come through the front door a few times a year. And what does this look like? What does this look like? Because that's where the value starts to either rise or fall. There's that bad word, profits. Profits, no matter what, at the end of the day, they really drive our ability to do things and to take care of people. It promotes growth opportunities, creates interest in the community. When we're running a profitable practice, a lot of things can happen. We can treat our staff a little differently, go on some CE adventures out of town, go to Vegas or on a cruise or whatnot, write that off, all have a good time together at the same moment. And when we're profitable and running a good business, I see a lot of owners giving more back to the community, and they're more active in those communities. They got a few more bucks that they feel they could spend on taking care of some people that are maybe underserved in their communities, or they go out and they sponsor some great nonprofits, or they sponsor some events and put up a tent and give away some toothbrushes and whatnot. And it just allows you to spread a little bit more love, so to speak, in your communities. And, there's an example that occurred here, like them or not, Trump did, break a lot of, lessen the burden of taxes for corporate America. And we heard a lot of those companies just turn right around and give more into 401ks, or give out some raises, or reinvesting into that business to make it more stable for their employees and their customers down the road, to make it a better place to do business with. So profits are not a bad thing at all. And if those 6 points aren't enough, you could put this one in as number 1 or number 7, but you always have competition. Every industry has competition. Dentistry has no less or no more than probably any other industry. But today, let's just pick on Illinois, where I live. There's currently about 67 dentists per 100,000 population in Illinois. And according to this ADA study, that's only going to rise for the next 20 years or so, through 2035 on this graph, to where it's going to peak at 78 dentists per 100,000 population. That's plenty of dentists, we'd all have to say. That's a little less than 1 per 1,000 patients, 1,200, 1,300 patients. So we're going to all have to be really efficient. and be working at the highest levels and running an attractive practice to make sure that we are getting our share of the work in the communities that we reside in. And Illinois won't be much different than any other state out there. There's more dental schools today. There's more kids in the classes of these dental schools. And so we just got to be aware of competition. Fortunately, I think there's a lot of integrity amongst dentists. So you don't see people directly stealing patients, but and hopefully when a patient comes through your door and you're prescribing a crown for $1,500, they don't just run across the street and ask your neighbor, how much is your crown? And your neighbor just throws out a number below yours, knowing what your number is. Hopefully they say, hey, what's going on? Why are you here? And let's sit down and talk and examine and blah, blah, blah. And, I'll reinforce what doctor was saying across the street, but I'm not going to steal his business necessarily. I still see a lot of that good stuff happening in dentistry. Plenty of integrity there, but we need to be aware of competition. And the DSOs are out there. Here's some cool takeaways. I just think some important takeaways, I should say, from that study done by the Health Policy Institute for the ADA. The supply of dentists is going to grow. The dentist workforce is getting younger, which is great, and there's a higher percentage of females. Females make up over 50% attendance in the dental schools, and now they're just over 30% of the working population of dentists in the US as well. And there's a big diversity in their backgrounds and cultures, which is terrific. Practice ownership rates, they're declining a bit in all age groups. We are seeing from our side of the business in transitions that practice owners sometimes are getting out a little earlier than we expected just because they don't want to manage the business anymore. So we do have folks that are running successful businesses. They're getting to 47 or 50 years of age saying, you know what, I want to keep practicing. I love being a dentist and serving my community. I just don't want to own this thing anymore. And there's nothing wrong with that. So we're seeing folks that are turning those businesses to other private entities that want to own their own practice or to the DSOs. And there's a place for DSOs, and they're a good place for many doctors and patients. Dentist earnings are on the rise. That's fantastic news. They've been stagnant for about 10 years prior to 2016, and doctor busyness is climbing rapidly, and the satisfaction rates, I should say, have climbed rapidly for the dentist population. During the recession, 35 to 45% of every dentist out there said they were not busy enough. And today, less than 25% are saying I'm not busy enough. And so that's almost an all-time high for those that are satisfied with their busyness at over 75%. So that's a really good sign for dentistry. And we need to see that because at the same time, that last point here is all about reimbursement and how in many areas that's declined with the insurance pressures. And so it's good that we're making more money as we're showing on that other point, and that busyness is high, and hopefully the efficiency and therefore productivity levels are at a high rate too, because reimbursement is falling a little bit in many places. So let's talk about practice transitions. It's a hot term. It's a hot term. It's a hot term because in the next 5 to 10 years, more dental practices will be transitioning the ownership of their practice than ever before in our history. And so basically you can think of practice transitions as a change in the providers in a dental practice. And first off, I think of associate placement. This is a change, usually an addition of a doctor into a practice in the form of an associate. They have no ownership in the business, but they're needed just to either allow the owner to back off a little bit with their time in the practice and the stress on themselves and the burden of themselves to be the sole producer, or the associates being brought in for other good reasons, which is that there's great growth in the business and you need another associate to sustain the care that's needed by the patient base, that's being demanded by the patient base. And then there's the forging of partnerships or mergers. We see plenty of action here. On the partnership side, it's where a doctor realizes they've got a big practice, a good sized private practice. Maybe they don't want to sell to a DSO and they want to attract in a long-term associate. And the best way to do that is to say, you know what, I'm also going to put in there that you can own a part of this business. And we recommend, if you're going to give up ownership, give up 50%, because anything less than that really truly doesn't mean anything to that associate there or soon to be partner. So we see more partnerships forming. They usually have a little probationary period in the beginning of, you know, maybe up to 6 months where there's no restrictive covenants to separate, and then maybe after that there's a little more time where restrictive covenants would kick in if it didn't work out from there. But then maybe after year 1, evaluation is done of the business, and maybe after year 2, 50% is sold based off of that that valuation done at the end of year 1. So we see a lot of partnerships happening. Mergers. There's plenty of mergers going on, and when I think of a merger, it's sometimes 2 doctors coming together to forge a bigger practice together, a group practice together. More often I'm seeing where we're just kind of tucking some patients in, tucking some files in from a practice that has, you know, been around a long time, and the production's way down, and somebody doesn't want to move into that practice, and it's really the best case is to just bring the patients down the road to another existing practice, and that doctor buys those files or the rights to those patients, the charts. And then the practice sale. Usually it's 100% asset sale that we're talking about in dentistry today. And between all of these 3 different scenarios, there's more transitions going on in the US than ever before. And how does all this relate back? What are some of the pitfalls we see with transitions that all go back to running an attractive practice? And so keeping value and people's perceptions in mind, and what our long-term outlook really is. Here's some pitfalls we see happening with folks as they prepare for making any changes in the business, any big changes in the business, such as transitions. The first thing that we notice when folks are trying to escape ownership for whatever reason, it's time to retire, just don't want to manage anymore, we see declining revenues holding things up. And this kind of turns off the attractiveness of the business. So it's important running a dental practice to make sure that we have revenues that are stable. They don't all have to be growing every year at 10%. That's not realistic. People know it's hard to grow, but they just need to be consistent. When we have declining revenues, one major pitfall we see is expenses get out of whack. And so we might have a practice running at $1 million and their expenses are in line at 65% of what revenues are. And then the business starts to fall. You know, we cut out a day, we stop marketing the business, and new patient flow kind of peters out. And so now we're down to $900,000 in revenues, but we're still running the same expense load. You know, our rent never changed, and we didn't downsize our staff or the hours for the team, because that's a sensitive subject in dental practices, and you all become really tight like family. And so we see the expenses kind of get out of whack. I'm dealing with a great customer in Chicagoland. They've had declining revenues. They've been in a large facility, and now the revenues just don't match up to what the facility offers and the high rent that they're locked into for a long time. And in this scenario now, their rent is at 15 to 16% of production, which is way too high, and it's turning off folks that might otherwise be attracted to this business. New patient flow, that keeps the heart pumping, you know. Always got to have new patient flow. When we don't have new patient flow, associate placements fail. That happens a lot. There's, you know, that's kind of teamed up with having capacity issues. Not having enough new patients is a capacity issue. Not having enough rooms to really facilitate more dentistry without expanding hours can be a big capacity issue that goes back to allowing new patient flow to come into the practice. Those 2 things really thwart a lot of the associate placement opportunities that we see. And when we have capacity issues, it can turn off potential new owners that might be looking at the business. If we have a 3-operatory practice that's run really well, It's just going to be hard to see the growth opportunities, and that could be seen as a capacity issue by new owners and the lenders of new owners who are really mindful of, hey, can this new owner that I'm lending all this money to, can they pay off this loan? Can they find growth in this business to easily pay off this loan? So those are some factors involved with new patient flow and capacity issues. And we need to make sure that standard of care is being met in our practice. Again, we don't need to be cutting edge, but we need to be what is foreseen as, what is pictured as being standard of care in the industry today. Otherwise, our valuations fall off. You know, the amount of money that people are willing to part with to purchase practices, that will falter when the standard of care is not there in the practice. That will sort of be discounted off of the price of that business and usually negotiated out of the business. We often start with a valuation of a practice, and then we get to those assets, the equipment in the business, and say, is it sort of standard of care? Or will the new owner expect that, hey, when they come in, they're going to have to buy certain equipment and technology to sort of get to where everybody else is, and so they're going to take that off the price they're willing to pay. And oftentimes we start that way with the valuation, knowing that they're going to have to make those investments, and we're going to need to show that deduction from the value of the practice so that we can attract new buyers. So that's definitely a pitfall. And this one kind of saddens me. This one kind of hits the heart. You know, sometimes we're so involved as practice owners, and I see this with a lot of practice owners. They love their business. They're very proud of their business, and they should be. They've owned it for 30 plus years, sometimes 40 plus years, and they don't want to see leaving it, and they're hanging on a long time. And you know what? There's no plan in place, and they just allow things to deteriorate, and that's fine. That can be a perfect plan as long as you're going to have a set retirement with good funds in place, and it just doesn't it doesn't matter what happens with the business. But oftentimes it does matter. It does matter big time what's going to go on with our business, and we need to have a plan A and oftentimes a plan B. And plan A we see sometimes, often, frequently, is a son or a daughter is going to go to dental school. And maybe it's a scenario where I've got a dental practice here in Illinois, and I'm going to send my son to Creighton. He's going to dental school there, and then he's going to come back and he's going to take over my business. I'm going to slowly transition it over to him, or obviously sometimes her, and that's going to happen the next 5 years or so. And then Cupid fires an arrow into your son down in Creighton, and he falls in love with a dentist candidate there who's from Oregon, and they graduate together, and the next thing you know, because of Cupid's antics, your son's going to be off to Oregon, and now that successor is gone, and you're kind of left with all the keys to yourself, and probably not a plan B, unfortunately. So make sure you got a plan A, and I would highly recommend a plan B. And sometimes the people working around you, they can't know about plan A and plan B. I've got to mention this because sometimes when your staff members hear about plan A and plan B, they love you, and they love you, but they're not so sure what's going to happen when new ownership comes in. So if they hear about somebody else coming in to take over the business, that you'll be selling it, or this associate's going to be offered partnership from day one, etc., they can get kind of happy feet and start looking around. The next thing you know, you're losing a hygienist, or you're losing a front desk person, a key member of your team. Sometimes you're going to lose an associate if they haven't been communicated to, offered the opportunity, and let's say they say no. They don't need to know that you're selling at that point, but you need to have that kind of figured out. You need to have transparent plans with that associate, I got to say, but otherwise keep it quiet to the rest of the team. Because I have seen where folks are getting ready to list their practice, and they tell me, hey, I told everybody on the team, I'm looking to retire and I'm going to sell the practice in the next year. And I kind of freeze up and gasp. And I say, you told everybody? Yeah, I told everybody. I'm like, ooh, and I kind of pause, and I hate doing that, but I know what the results can be. And sure enough, in this case, we sat back down. I said, are we ready to rock and roll? And has anything changed? And unfortunately, this doctor had to tell me, yeah, I lost my hygienist 2 weeks ago. And my front desk person just told me they're putting in their 2 weeks. They said they're going to give me a month, and I thought, oh, I felt so bad. So we got to, sometimes keep those plans to ourselves, especially those big plans. Keep the cash flow going. Cash flow provides for so many good things. One, to keep up with technology, have the right tools in place, and communicate well with your staff and your patients. But if you don't have the right cash flow, people may not be able to afford your business. And I know that sounds strange, but banks today don't want to lend for startups. A lot of banks just refuse entirely to get into that arena, and they will only fund for acquisitions of existing practices. And they do so because they know there's an established patient base and production with those patients and profits from those patients. And when they are aligned with a good buyer who's got good clinical skills to take over your practice, they're going to be looking to make sure that the cash flow coming from your practice will more than equal what their debt service is for that loan for the business they're going to provide and the loans outstanding they already have from dental school, and still have money left over for a good standard of living. So that's an important communication on the cash flow front. And ultimately, at the end of the day, if we're keeping our eye on those 6 key metrics and we're thinking about how we appear to not only the people that we interact with today in the form of staff and patients and current providers, but who the future providers could be in the practice, and staff members and new patients coming on in, we're going to do all right. And we're going to avoid most of these pitfalls. And that's really the end of my formal presentation. I know we've got some time now that will be directed for questions from David. David, thank you so much for this opportunity. I'll just stand by from here and see if there's any questions to take. Thank you all for listening in.
Thank you so much, Rex. We do have some time remaining for Q&A, so let's just dive in. The first question that we have is, let's say I want to sell my practice. How do I start that process?
Yeah, at ddsmatch, the process starts with having a confidential conversation. It's a free conversation. We really feel like we're working towards, owners' goals for their future. And so we want to talk all about what those future plans look like to our doctors that are looking to sell. We get into those goals and the challenges that surround those goals, and then some of the strengths and opportunities that we have at our fingertips based upon the background of that dental practice. From there, we do evaluation. We do a formal evaluation with a third-party accounting firm that gives us a really strong foundation for showcasing the wealth of the practice to potential buyers. We also do a little clinical report for our doctors so that we're really marketing this practice and its full potential to any onlookers. Then we take it out to the marketplace, and that's kind of how it all starts. That's how it all starts.
The next question is, are there any basic metrics regarding what percentage of revenue should be dedicated to marketing, overhead, etc.?
Yeah, there's a little more talk in the marketplace about EBITDA. That's earnings before, taxes, depreciation, etc. And traditionally, though, we're going off of collections, and it's usually an average from the 3 years of production, the last 3 years of, collections, and then we're taking a percentage of that. We're at a higher percentage on average than ever. Those multiples are higher in urban areas, big metroplexes like Chicago, LA, New York, etc. Falls off a little bit in rural communities where demand is a little bit lower, but we're definitely going by, generally speaking, the percentage to collections for our pricing. And we're sitting somewhere around 70%, give or take, depending on where we're located, etc., and how the practice looks.
The next question is, what kind of trends are you seeing with ownership transitions?
Yeah, the trends that we're seeing with ownership transitions, we are seeing a lot more practice owners prepare earlier and trying to attract a future partner into the practice. We're also seeing where the DSO involvement is at a really high level, probably higher than in history ever in dentistry. And they're sort of getting their mitts around the bigger practices where it's harder for a private practitioner, a less tenured private practitioner, to afford that practice. Those are two trends we're seeing.
The next question we received is, how are practices valued today, and are you seeing any trends with that?
Yeah, the valuation of practices, it's sort of a breakdown of what we spoke about here. We're looking at the production and collections. It's really critical to have high collections to a percentage of your production. We're looking at the expense load, and is that in line with tradition, or do we have higher expenses or lower expenses? And at the end of the day, it's a breakdown of what the collections of the practice are and how the cash flow is coming out of that practice. Is it above level? Is it below level? And then we look at the physical assets of the practice, the location of the practice, and we take all those into consideration as we formulate the total value of the business and where we should price it to market.
The next question we received is regarding the pricing. Did you say that 70% of collections is the fee?
The pricing of the practice itself, do you think that's what that is, David? Price to market?
I believe so, yes.
Yeah, usually it's coming from the average of the last 3 years collection multiplied by 0.7, and it could be higher, it could be lower, it all depends on where we're at, but that's kind of a good average for today.
Next question we received is, what's the best way to calculate office earning potential based on office capacity and the number of working days?
The earning potential of a practice will be greatly influenced by the ability to attract patients into that practice. And then do we have the facility that can take on that patient load and potential production that goes along with it? If we're running a solid hygiene room, 32, 36 hours a week, in some communities that's a $80,000 a year production room. When we're talking about a doctor's operatory that's running the same hours, 32, 36 hours a week, we could be 3 times that figure of the hygiene room. And so we'd be looking at, around 500,000 for that, 540,000 exact. So that's kind of the ratios I go by looking at a practice. If I'm just to see operatories and I don't know much more, I'm going to think about how many of them are going to be dedicated to hygiene, and then how many are going to be dedicated to operative. And let's say they were running at full capacity. That's 32, 36 hours a week in general for most practices. That's how I'd come to that formulation.
Okay, well, that will wrap up our webinar for the day. Thank you so much to Rex Plamann of ddsmatch Chicago for this wonderful webinar. And thanks to everyone on the line for joining us. A recording of today's webinar will be available by tomorrow. Until then, have a great rest of your week.